Hi all, welcome to a new video. Today I am here to speak something about the factors that regulate erythropoiesis. So before going to this topic, what is erythropoiesis? Erythropoiesis is the development of matured red blood cells, means the development of matured RBCs, the development of erythrocytes is known as erythropoiesis. So erythropoiesis is the development of matured RBCs. So coming to our topic today, factors that regulate erythropoiesis. So I have written in the board already to save the time. There are certain factors that regulate erythropoiesis. There are environmental factors, hormonal factors, hemolysates, vitamins, metals and the proteins. So in some textbook it is categorized as dietary factors, intrinsic factors, extrinsic factors. So in this way also it can be categorized. It is easy to remember: environmental factors, hormonal factors, vitamins, hemolysates. Hemolysates means the products of the hemolysis, the end products after the hemolysis, the products are there. The products of hemolysis is called as hemolysates. So after the red cell destruction, the hemolysis, the products what it is there, that can also affect the erythropoiesis. Vitamins, metals, proteins. So coming one by one, environmental factors, you know, mainly the main environmental factors is hypoxia. What happens in hypoxia? What is hypoxia? Hypoxia is the decreased oxygen content in the blood. So there are different types of hypoxia: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, histotoxic hypoxia. So mainly in high altitude, we see the hypoxic hypoxia, high altitudes, there is a decrease in the oxygen content of the blood. So any time when there is a decrease in the oxygen content of the blood, what happens? One of our main organs, kidneys, senses this particular the oxygen levels in the blood, and it is, what does it regulate? What does it release? It releases a hormone known as erythropoietin. So the kidneys are the organs which senses the decrease in the oxygen level in the blood, and it releases a hormone known as erythropoietin, which can stimulate erythropoiesis. So one of the factors is hypoxia. The main environmental factor is hypoxia. High altitude, there is a decrease in the oxygen content of the blood, which can stimulate the erythropoiesis. There can be increase in the RBC count. Second factor, hormonal factors. We have many hormones. We have ACTH. We have TSH, thyroid hormones, T3, T4, etc. We have estrogen, erythropoietin, as I earlier told you, erythropoietin, etc. Even growth hormone. Okay, there are many hormones coming in the category as hormonal factors. Majority of these hormones stimulates erythropoiesis except estrogen. Estrogen is the one which inhibits erythropoiesis. So ACTH, thyroid hormone, TSH, growth hormone, erythropoietin, all these things, androgens, again one more thing, androgens you can add, androgens also stimulates erythropoiesis, whereas estrogen inhibits erythropoiesis. So there are the hormonal factors which can also affect or regulate the erythropoiesis. Coming to the vitamins, before that, hemolysates. Hemolysis, I told you, it is the product of hemolysis. So red cell destruction, the products of the red cell destruction can also affect the erythropoiesis. Coming to vitamins, mainly we have vitamin B12, folic acid and ascorbic acid. These are the factors that can regulate the erythropoiesis. So vitamin B12, the Cassell's factor, intrinsic factor, folic acid. So this can be also told as dietary factors. Even the metals like copper, cobalt, iodine, etc. Even manganese, all those things are also dietary factors. This can be included in the dietary factors, vitamins and metals. So these can also regulate or affect the factors that can regulate the erythropoiesis. The proteins, mainly the protein, what is the protein? We have albumin. Albumin is the main protein that regulates the erythropoiesis. Also there can be the dietary factors with calcium. Calcium can also regulate erythropoiesis. So these are several factors that regulate erythropoiesis. It's a short video, I have just told you brief things. So we have 6 categories what I have written on the board. Hormonal factors. The first one is environmental factors. Second is hormonal factors. We have hemolysates, that is nothing but the products of the hemolysis. We have vitamins, metals and proteins. Environmental factors, mainly it is hypoxia. Okay, hypoxia is the main factor. Hypoxic hypoxia, high altitude, there is a decrease in the oxygen content of the blood. The kidney can sense this decrease in the oxygen blood in the oxygen content in the blood, because it has chemoreceptors. The chemoreceptors can sense the decreased availability of oxygen in the blood. So it can release the hormone known as erythropoietin that can regulate the erythropoiesis, stimulating the erythropoiesis, increasing the number of RBC count. Hormonal factors, androgens, ACTH, TSH, thyroid hormone, etc. They all stimulates erythropoiesis. Even erythropoietin also stimulates erythropoiesis. Whereas estrogen inhibits erythropoiesis. That's why testosterone stimulates erythropoiesis. That's why the males have more number of RBCs and hemoglobin compared to females. Whereas in females, what happens? Estrogen inhibits erythropoiesis, and also it's a cyclic loss of blood during the menstrual period. So estrogen is the one which inhibits erythropoiesis, whereas the other majority of the hormones stimulates erythropoiesis. Hemolysis, red cell destruction, as a part of that, it can affect the erythropoiesis. Vitamin B12, folic acid, iron, ascorbic acid, all these things can regulate the erythropoiesis. Cobalt, copper, iodine, etc. also are the dietary factors that can regulate erythropoiesis. And ultimately, finally, you can say proteins, mainly proteins. It is albumin that regulates erythropoiesis. So that's all about my class today, a short video. I hope it will be helpful for you. Thank you.